Understanding the Nomenclature of Neoplasms, a discussion on tumor naming conventions. Welcome to today's episode, where we explore the fascinating and essential system of naming neoplasms, or tumors, an area fundamental to the field of oncology. In this episode, we will unravel the concepts and conventions that shape how tumors are named, based on their biological behavior, tissue of origin, and microscopic appearance. Let us begin with the foundational classifications. All neoplasms are categorized into two broad groups, depending on their behavior. The first group comprises benign tumors. These are generally not life-threatening unless they occur in a critical location. Benign tumors tend to grow slowly, remaining confined to their local area and are often encapsulated. Importantly, they do not invade surrounding tissues nor do they spread to distant sites. The cells in benign tumors are well differentiated, meaning they closely resemble the tissue from which they originate. On the other side of the spectrum, we have malignant tumors, commonly known as cancers. These are potentially lethal because of their rapid and unpredictable growth. Malignant tumors invade and destroy surrounding tissues and have the capacity to metastasize, meaning they can spread to distant parts of the body. The cells in these tumors are often poorly differentiated, sometimes described as anaplastic, which means they have lost the characteristics of the tissue from which they arose. Let us now discuss the rules for naming these tumors. The nomenclature typically combines two elements, a prefix indicating the cell or tissue of origin, and a suffix that denotes whether the tumor is benign or malignant. For benign tumors, the suffix is almost always oma. The naming follows a straightforward rule. The name of the cell type is followed by the suffix oma. For instance, a benign tumor of fat cells is called a lipoma. A benign tumor of cartilage is known as a chondroma, and a benign tumor of bone is referred to as an osteoma. If a tumor arises from fibrous tissue, it is named a fibroma. Benign tumors of glandular tissue, such as those found in the colon, are called adenomas. However, it is important to highlight some notable exceptions. For example, melanoma and lymphoma, despite ending with oma, are actually malignant tumors. Cutaneous melanoma is a malignant tumor of melanocytes, and lymphoma is a malignant tumor of lymphocytes. Furthermore, the term hematoma does not refer to a tumor at all. Rather, it signifies a localized collection of blood. Similarly, granuloma denotes a collection of inflammatory cells, not a true neoplasm. When naming malignant tumors, conventions depend on the tissue of their origin. There are two principal types of malignant tumors, each following its own naming convention. The first type is carcinoma, which arises from epithelial tissue. Epithelial tissue includes the lining of body surfaces such as the skin, gastrointestinal tract, and respiratory tract. It also encompasses the parenchyma of organs including the liver and kidneys, as well as glands such as those found in the breast and prostate. Carcinomas are the most common form of cancer. A malignant tumor of glandular tissue, for example, is called an adenocarcinoma, which can occur in the prostate or lung. A malignant tumor arising from squamous epithelium, such as the skin, esophagus, or lung, is known as squamous cell carcinoma. When a tumor is confined to the ducts in the breast and has not invaded surrounding tissue, it is termed ductal carcinoma in situ. The second major type of malignant tumor is sarcoma, which originates from mesenchymal or connective tissues. These tissues include bone, cartilage, fat, muscle, blood vessels, and fibrous tissue. Though much rarer than carcinomas, sarcomas are significant. Examples include osteosarcoma, a malignant tumor of bone, chondrosarcoma, which arises in cartilage, and liposarcoma, a malignant tumor of fat cells. Malignant tumors of smooth muscle are known as leiomyosarcomas, while those of skeletal muscle are called rhabdomyosarcomas. Angiosarcoma refers to a malignant tumor of blood vessels. Let us now turn our attention to tumors of lymphoid and blood cells. These neoplasms are always malignant, despite the oma suffix. It is a historical naming convention that persists. Leukemia refers to cancers arising from blood-forming cells in the bone marrow that circulate in the bloodstream. Lymphoma denotes malignant tumors of lymphocytes, which form solid masses in lymph nodes or other organs, such as Hodgkin lymphoma or diffuse large B-cell lymphoma. Multiple myeloma is a malignant tumor of plasma cells found in the bone marrow. There are also other conventions and special cases to be aware of. Mixed tumors are those that derive from one tissue type but differentiate into another. The most commonly known example is the mixed tumor of the salivary gland, also called pleomorphic adenoma, which contains both epithelial and mesenchymal-like components. Teratoma is a type of tumor derived from germ cells, or pluripotent cells, and can contain tissues from all three embryonic layers, such as hair, teeth, bone, or thyroid tissue. Teratomas are most common in the ovary and testis, and may be benign, termed mature teratoma, or malignant, called immature teratoma. Blastoma refers to a malignant tumor that is embryonal in nature and typically occurs in children. The tissue in these tumors resembles the immature, embryonic form of the organ. Notable examples include neuroblastoma, which affects the adrenal gland, retinoblastoma, found in the eye, and nephroblastoma, also known as Wilms tumor, occurring in the kidney. There are instances in which malignant tumors use names that do not follow the standard conventions. For example, melanoma, mesothelioma, a malignant tumor of the mesothelial cells lining the pleura or peritoneum, and seminoma, a malignant germ cell tumor of the testis, are exceptions to the general naming rules. Additionally, some tumors are named after the people who first described them, though this practice is becoming less common in favor of more descriptive terminology. Hodgkin lymphoma is distinguished from other non-Hodgkin lymphomas, and Wilms tumor is another example, also referred to as nephroblastoma. Ewing sarcoma is a type of bone cancer named in this manner. In some cases, tumors are described by their location and appearance, such as glioblastoma multiforme, which is a highly malignant brain tumor. Understanding the nomenclature of neoplasms allows clinicians and pathologists to communicate precisely about a tumor's expected behavior and origin. This clarity is essential, as it directly guides decisions related to diagnosis, treatment, and prognosis. Thank you for joining us in this episode. We hope this discussion has helped clarify the principles behind tumor naming conventions and their practical importance in the field of pathology. Please subscribe for more informative content on pathology, and share your thoughts and questions in the comments below. It's the Everything Surgery Podcast. Dissect the extraordinary.